And so I went through that big surgery and all of that really for nothing, really. And, nobody talks about the rehab, the sickness from the anesthesia or being laid up in bed and all that. And so between all of these things, I'm like, there's got to be a way for me to overcome this. I can't just take pain meds. I don't want to take any meds that actually would affect me cognitively. And so I stumbled on something called prolotherapy. Prolotherapy basically involves injection of a sugar-based solution. And what that does, it creates inflammation that's kind of controlled where it actually stimulates healing. And so I started getting trained and started learning about that back around 2012 or so out in Colorado. And that was something that started to begin to make my foot and ankle issues a little bit better. Eventually I started learning about platelet-rich plasma, or PRP, where we take blood out from you. We concentrate and we inject it back in. I had a couple of rounds of that on my plantar fascia, which is the bottom of the foot there. That finally got rid of that. For my Achilles, the doctor wanted to shave the bone down on the back of my heel. And it's not as simple as doing that, because it's actually detaching the tendon, shaving the bone down, putting the tendon back on with some anchors, being in a boot, being laid up in bed, taking pain meds to overcome some of that. So not something that I wanted to do, especially after a failed knee surgery or whatnot. So I actually had to do a lot of rounds of PRP because it was pretty damaged to overcome that.